does this issue of prostate affect sexual performance? Does it affect? Is there any relationship? Is there any relationship between prostate health and sex, sexual libido? Does it affect?
Okay, so to quickly answer the question, some levels of advanced prostate enlargement could be there could be what is called a complication in form of infertility.
Okay.
For instance, the cells, we said, if it is cancerous cells, it goes, we all mean by cancer is cells are dividing very rapidly, and they make the prostate to enlarge so much that they are now blocking the urethra. So if they are even blocking the urethra, not just that, some of them will now spread outside the prostate. They go to all the surrounding organs. They go to the testes, they go to the bones, they go to the kidneys, they go to different places. So in the long run, some of them could have what looks like a reduced fertility because of the affectation. For instance, we know that semen is being produced primarily from the testes, and there's a combination of the seminal fluid that is coming from the prostate. So if the prostate is now so much enlarged and it's cancerous, it can actually affect, there's also what is called testicular cancer.
Okay,
so
yes.
it can then begin to affect the testes, and then it also affects the prostate itself, that the effectiveness of these organs are actually reduced.
So that means it can affect erection.
In the long run, yes, it can. It can affect erection.
Okay, and I'm smiling here because Pastor Ilori is asking a question which I also have in mind too. There's this myth I want you to MYTA that I want you to debunk. The issue of can too much sex or abstinence from sex cause prostate? Dr. Pastor Ilori is asking if they said if you don't have frequent sex, it can cause prostate. And some people say if you have too much sex, it can cause it. So there is this two different opinions about too much sex or abstinence causing prostate. Doctor, can you give us a balance tonight, please?
Okay, balance tonight, straightforward, man. Like I've said, I'm not sure if I mentioned this today. So the exact cause of prostate cancer or prostate enlargement is not known.
Okay.
There are theories, but like you said, this is a myth. It's a myth because what causes the enlargement of the prostate is not the production of the seminal fluid. Because if we are talking about somebody, a sexual intercourse or production of semen, that is what helps to release the semen. But what actually, we call it pathophysiology. Now, what actually goes under in terms of the enlargement of the prostate is not about the release of the semen. It's about the fact that the small cells that make up the gland, they are increasing in size. They are increasing. Some of them are beginning to divide rapidly. So they are the ones that are causing the enlargement. So it is specifically not because somebody is having too much of sex or is not having enough.
Okay. Yes. I think that's a balance, because we often hear this one will say if you don't have sex, it's because if we have too much. Anyway, there's another question. Doctor said prostate cancer is preventable. What are the preventive measures used to? It's one of the questions I penned down, that how can you help your prostate? How can you make your prostate happy? I think I saw that question somewhere, and I said I was doctor. How can you make your prostate happy? I think it's related to how can you prevent? What prevents measure? Thank you, doctor.
Yes, thank you. So this question is also straightforward. This is asking that what are those things, like generally when we talk about prevention of cancer, so preventing or things we can do to prevent an organ from enlarging. Because what happens generally in cancer is that an organ is just enlarging unnecessarily without control. So what are those things that are risk factors for such enlargement? So we talk about exercise generally. We know that the causes of cancer are not specifically known, but there are things we can avoid. We can avoid smoking.
Okay.
Because we know that cigarette itself contains a lot of carcinogenic materials. Carcinogenic materials that are able to cause cancer. So avoid it. Avoid alcohol, excessive alcohol. Okay. Now, mommy was at the point we are talking about, is there a relationship between faith and even health? Now, these are some of the things. For those of us that are believers, we have said it that when God was giving us instructions, it's not because God has a girlfriend that he doesn't want you to collect. No, that's not the reason. It is for our own good. So if he says, "Oh, abstain for anything that destroys your body is the body temple of the Holy Spirit," and say, "No, you are just talking." No, cigarettes can affect any organ, just like it can affect any organ in the body. It can affect the prostate. Alcohol Just like can damage organs, can damage kidneys, can damage the heart, can also affect the prostate.
Yes, yes.
Reduce exercise. So we must try to make sure that we exercise very well. We must
That's
make sure
right.
that we eat balanced diet, because eating in balanced diet, things that are not balanced can actually cause different kinds of changes in the cells in the body, which can, and considering the fact that prostate is one of the organs in the body, can actually cause some changes in the cells. You don't want things that we use the word mutation. You don't want things that will go to any organ in your body to cause them to begin to misbehave,
Hmm.
if I'm allowed to use that word.
Okay.
So good exercise, eating balanced diet, avoiding smoking, avoiding alcohol. All these are preventive measures. And we have said if somebody has a family history, you must quickly go for test or for review.
Somebody is asking, can the type of food the type of food we are talking about cause, okay, can certain food cause prostate? I think that's what the person means, doctor.
Yes, I think that's what the person means. It's difficult to tell, but any food that has a tendency to affect our body system in terms of balance diet. For instance, now some people have mentioned that any diet that is rich in red meat, for instance,
Okay.
but that's a general statement anyway. I mean,
Okay.
any food that is very rich in red meat, for instance, can affect the heart, can affect the blood vessels, can affect the kidneys, can affect the prostate. So any food that is not healthy, and things that some people have said you shouldn't eat too much of canned things that are be every time is just junks, every time it's just junks. We have said that some of these things are risk factors for cancer in many years to come. May not be the next 10 years, may not be in the next 5 years. So it is good to eat balanced diet. So anything that is going to cause more stress to the body, that does not have enough vegetables. So it's always good to maintain good balanced diet to avoid all these foods that may have the tendency to affect the body generally. Yes,
Thank
ma'am.
you, doctor. I think that one even answered the question of how do you
Mm,
keep your prostate happy? Eating well,
yes,
doing exercise. I think that answers it.
yes, ma'am.
Okay, let's know where you are connecting us. Oh, Pastor Dele, thank you very much for connecting us.
Yes,
Let's
ma'am.
have your questions in the chat, please. The doctor is here to answer all our questions. Thank you very much, Mommy
Thank you, sir.
Olajike, for connecting us. Thank you. Thank you. Let's have the questions and let's appreciate Doctor in the house. It's a privilege to have him here. Okay, doctor, you
Yes,
can,
ma'am.
before the next question comes in, you
Okay,
can continue, sir. So,
okay. So,
okay, Pastor Ilori is really with us tonight. What can
okay.
some I love that. I love what Pastor Ilori is when he's connecting us. Thank you. What can someone who has this problem do if he wants to embark on a long journey? On a long journey, he was
Mm,
and is afraid of urinating frequently on the way. Okay,
mm,
probably somebody who has already been diagnosed has the problem of urinating frequently.
yes,
What can the
yes,
person do, doctor?
yes. So, thank you very much, sir, for this other question. Sir, do you know, Ama, that this was my first when I came to do my exam in the UK to
Okay.
practice. This was the first question.
Wow.
This was the very first question. The patient I had exactly this problem. So the issue is, if somebody has been diagnosed to have prostate enlargement or prostate cancer,
Mm-hmm.
ideally, let us use just prostate enlargement. The person should
Okay.
have been put on medications normally.
Okay.
There's all called tamsulosin. That's the one that works very effectively. It works very quickly. We give it to them. And if
Okay.
not working, we give the second one, which is another type, which we give it to them to combine. So ideally, they should have been on medication. The medication helps to reduce the size of the prostate. Some of them, it just helps them to be able to give way for urine to be able to pass through. So they will not have issue with urinary retention or frequency. But if it then happens that, for instance, somebody is on a long journey, is on a flight from Nigeria to Canada or to Australia.
Yes, several hours. Okay.
So the question they asked me that exam is that this gentleman, he came with urinary retention, and the story is that he flew from America to the UK. So the point is, long flight, sitting down on this in the same position for a very long time is a risk factor for urinary retention.
Wow.
So because anybody who knows that he has this problem, ideally should have been on medications.
All right.
Okay. For some of them, some of them, there are some of them by the time we are discharging them, when I was working there, and some of them you have to leave the catheter in.
Wow.
Yeah, some of them have to leave the catheter in until a particular time that are going to be reviewed to decide whether they can now do without the catheter, because some of them actually have to leave on the catheter for some time so that they will not have urinary retention. So the advice will give somebody that is going on a long flight should have been checked by his doctor to decide and say, sir, do you have to be on tamsulosin before you go? Do you have to be on catheter? You just hide it in your place before you go, or So they just assess him before he goes on a long flight because he has a
Okay.
chance of developing retention.
Okay, for someone who has been diagnosed, he needs to go
Yes,
for assessment. He needs to go
exactly,
for before embarking on that journey. And does
exactly.
it mean the medication will help, reduce the times of
Yes,
time he goes to the toilet?
yes,
Will it
exactly,
reduce it?
exactly. We've
Okay,
not been able
those
to
are
talk
the
about.
one taking flights, sir. Let's talk about those
Yes,
from on a level,
okay,
probably in Nigeria, traveling from Kano or Abuja to Ibadan,
okay,
and they may not want to be, stopping along the way.
exactly.
So is it still the same thing? Because
So
does it mean
yes.
they will not even need to urinate at times along the journey? Is that what
Hmm.
you mean, doctor?
Generally speaking, ma, we use a term when we are addressing patients. We say we individualize treatment. Individualized treatment means that for somebody, it could just be from Kano to Lagos. It's already frequenting. So, and for somebody, we will say, ah, no, until I travel out of the country long, that's when I begin to have it. So we individualize when we see them.
Okay, okay,
And
okay,
says, but like I said, the tamsulosin is a
mhm,
very good medication to start with, which
okay,
if the person has been taking it regularly, it helps them not to have frequency. It takes care of the time number of time they have to go to toilet. So they must have been on that for a while before they go. So irrespective of whether it's Kano to Lagos or outside the country, it is better to have been on treatment, and
okay,
then they can actually embark on their on so that they will not develop retention when they are in the flight.
okay. Thank you very
Yes.
much, doctor. Let's have your questions in the chat, please. Let's have your question. Thank you for connecting us, Pastor
Mommy, sorry,
Momiola.
ma. I'm seeing a
Yes.
question here.
Okay.
I'm not sure you've seen it. We say, Doctor, why the medication to prevent or cure prostate was unaffordable for poor people in time of
Okay.
cost?
Okay, I didn't see that. Who asked that? I did.
I think it's Pastor Ilori. I'm not sure.
Okay,
Yeah,
it's Pastor Ilori. Okay, okay,
yeah,
okay,
yeah.
okay.
So this is this way now I may get a bit emotional.
Okay,
I
doctor.
may get a bit emotional because I worked in Nigeria. I worked in a teaching hospital in Ife for several years before I left Nigeria. And I know that one of the challenges we have as a country is the issue of not
Mm,
having enough support, funding from the government
mm,
for people who are not able to afford essential medications. What Nigeria calls, for instance, the NHIS is not even for everybody.
mm.
So even sometimes it covers some tablets or medication, it doesn't cover some other medications. But for those of us who are in the NHS, for instance, for some of us, we know that, oh, you have access and you have the government is helping you, they are funding, they are assisting you and everything. So I think it's not the best. I mean, every government should try to make sure that things that are as essential as this tamsulosin and some other ones, 5-FA reductase inhibitors, finasteride, some of these medications truly may be very expensive. So we are just pleading, and not just with government, ma. People like you, mommy, and me too, if you have the opportunity. I mean, people have foundations in which they
Yes.
say, oh, if there are people with prostate cancer or prostate like who are not able to afford their care, they just go there and say, we
Mm,
just donate medications, donate money to the hospital to make sure that they supply to people. So
that's
it's a bit unfortunate, but that is the reality. Yeah.
that's a very good suggestion,
Mm,
doctor. Thank you very
mm.
much for that. Thank you very
Yes,
much.
ma'am.
Let's have your questions in the chat. And like I was asking that, doctor, what's the relationship between our faith and our
Hmm.
health? I want you to
Hmm.
still talk about that. I've had
Okay.
so many amazing testimony from Dr. Ilori in the past, maybe in the course of his experience in surgery, where he had to rely on the Holy Spirit. Oh my God, those testimonies were
Yes, sir.
amazing.
Yes, sir.
And it's one of the things that has actually endeared me to you. I'm so
Hmm.
much. Pastor Ilori is a man after my. I will call you Pastor. You see now I'm transiting. Dr. Ilori, Dr. Stroke Pastor Ilori is a man after my heart. Each time you hear testimony of his experience in the field of medicine,
Hmm.
the relation between his faith in
Hmm.
Christ and medicine,
Hmm.
they are
Hmm.
amazing, beloved. So I want you to just a word,
Hmm.
hope, courage for people out there.
Exactly.
Some people might have been diagnosed, some people have not even been
Hmm.
diagnosed, but I know that
Yes.
there is a strong relation between our faith and our health, because without faith we
Exactly.
can't please God. So
Yes.
thank you, doctor.
Yes, ma'am. To answer the question simply, ma'am, there's a very strong relationship. There's a very strong link. It is both scientifically and spiritually established. So if you talk about it spiritual, so you are talking like that because you say you are a pastor. That's why you're talking. No. Professor Ben Carson in the United States,
Yes, yes.
neurosurgeon, they carried out a research and they found out that there's a relationship between faith and healing. They found out that if you notice, man, if you go to the doctor, if you come to us, our curriculum of history taking embedded in it has a column which is called religion. Have you noticed, man? There's a place called religion. Even in the UK. And then you ask, why are you asking the patient, do you have a religion? Even here in the UK, you must ask them. Some will say, oh, no, I don't have. Some will say, yes. Are you a Christian? Are you a Muslim? Are you Hindu? So the reason is because it has been found out that people who believe in a higher being have hope that they will recover. And for them, they recover faster than people who have no hope in believing in a higher being.
That's key.
There was a boy who Professor Benkasi operated on him. They took out a tumor. While he was recovering in the hospital, is the lady that he wanted to marry. When he heard that he was already down, he was sick, they were already operating tumor on his head. The lady broke up with him, and they brought him news. The lady didn't visit him throughout. And the boy said, oh, so that's what happened because I was sick. By the time they discharged him, I go back home, the tumor relapsed.
Oh my God. You
So
see?
Professor Van Kassen gave that as an analysis, and he found out that for those people who had very good family support, even in the UK here, we'll ask you, do you have good family support? Do you believe in God? Do you have religion? The reason is
Wow.
because people who have hope that is going to be well and they believe in God, they
That's
have a higher chance of recovering than people who have no hope at all.